Good morning.
Good morning, ma'am.
How many members attending exam? Yesterday. Only 24 members. Balance mark is where?
Ma'am, here so much network problem, ma'am.
One mail sending means that much network problem, huh?
Ma'am, raining.
Huh? That is not even an excuse, okay?
Too much raining, ma'am.
Raining also up to here. Now I am opening the mail. That time I saw 24 members only sending answer sheet. Balance in your match, how many? 70 to 70 member is there. Only 24 members sending means what is this? Okay, today I will take the copy and I will see who are sending. Wait, child. Okay. Therefore, yesterday I am taken family healthcare settings in home visiting finisher. Next one is the bag technique. You saw in this bag anywhere community bag? Don't know. So no.
No, ma'am.
Because you people not coming here now. In our college, is there community bag. Okay. Community bag, a tool by which the nurse during her visit will enable her to perform nursing procedure with easy, safe time and effort. It means bag means this is the community bag. So many articles is there in this bag. Okay. When we are going a home visiting, it means community health nurse going in a home for visiting purpose. That time we want to take the community bag also. Okay. Purposes. The bag is needed during each home, school or industrial visit for inspection of the client like EPM, for performing certain procedures like urine analysis, antenatal assessment. Okay. Supply and equipment. One outside pocket. Here you coming back. In college you coming back now. That time I will show the bag. Okay. That time you can understand easily. And supply and equipment, outside pocket, towel, soap, and one newspaper. It means newspaper means we are putting a newspaper, then only we will keep the bag under the newspaper, because in that surfaces also maybe any fungus, any bacteria is there, means that is not good. Okay, that's why we are using the newspaper. And soap for hand washing purpose, and towel. Okay, then inside the bag, cotton or plastic bag with the cotton swab, bandage, small dressing packet. The small dressing packet is there. In that dressing packet, whatever cotton have maybe and small gauze piece, okay, and bandage. That is the small dressing packet. Next B, instrument and equipment, R3 forceps and descending forceps, scissor, eyedropper, solution bowl, plastic kidney, basin, oral thermometer, and rectal thermometer. This article also want in a B, instrument and equipment. That is the one side of the bag. Next is supply and equipment continue. Solution and drug, plastic bottle with a spirit, bottle of a Dettol, eye ointment, medication, urine analysis kit. Urine analysis kit means when we are going in a one home, maybe that is sugar patient. Sometimes the patient will tell, sister, you check my sugar. Okay, that time we cannot take the which one? Sugar analysis equipment is there now. What is that name? I forget it. Okay, sugar checking machine is there, and that we cannot take because in this bag, old age bag, it means community health bag means we want to do in a manually. It means one glass tube is there. In that tube, we want to take the urine and we want to put 2 drops of the liquid and we will mash means its will color will change. Okay, that time we can analyze that patient how sugar or not. You coming there, I will show you the procedure. Okay, urine analysis kit, inch tape, plastic tape, rectal tube or funnel syringe and needle and glass slider for subs. Okay, this is the another one packet. Now understand how many instruments in that bag. Yeah, back technique maybe will ask the important question only. You should write the heading and what is the purposes of back technique and what is the equipment inside the bag. That also you should maintain. Okay. Understand?
Yes, ma'am.
Yes, ma'am.
Is the principle for using bag technique. Prevention of contamination, protection of the caregiver, make articles readily accessible, make follow care. Okay, prevention of contamination, protection for the caregiver, make articles readily accessible and make follow up care. That is the principle. Procedure, you can see this is the bag. Okay, community health bag. Okay, inside before in upper, I'm mentioning now some instrument there that we are keeping inside the bag when we are going a home visiting. That time we are taking the bag and we are going. Okay, procedure: select area homework, spread newspaper. I will spread. I already told spread one newspaper and put in the bag. You can see here newspaper is there. Always time where we wherever we are keeping the bag, you should keep the newspaper, then you keep under the newspaper the bag. That is the procedure. Okay. Next is spread newspaper, remove hand wash material and wash hand. And procedure can remove the apron from the bag and put in. You see, like this apron. Okay. And remove needed equipment. What equipment we need means we want to take out and close the bag. And after the procedure, wash hand under the tap water. Okay, and spirit and wipe and procedure continue. If we use cotton swab, moisture wipe outside, use a bottle and wait for 5 minutes, return articles to the bag. What is the procedure is then means then you do the procedure, then keep inside all articles and then you wash the your hand. Okay, and fold used newspaper with used side inside and return to outside pocket. It means fold used newspaper with the used side inside. Where the used side the newspaper, that will be inside and the return outside pocket. You keep in a outside pocket. Close the bag and you write a report of what was observed, what was done, instructions given. Okay. What we are doing in that house and the school and any industries we are going means we want to take the bag and we do the procedure. Then you make the report, whatever we are done. Okay, nurse's responsibility, the bag should contain all necessary articles, supplies and equipment. You should maintain all articles. Yesterday also I told on home visiting means we are plan the home visiting. It means what purpose we are going that home, what type of visit we are done. You should plan. That planning based, you should arrange the bag also. That is nurse's responsibility. Okay, when we are going in a home, that equipment is not in our hand. Inside the bag means what will happen there? What will happen there? That is not good. One hospital, one equipment is there, not there means we can take the equipment in another house. Okay, but when we are going a home, in that home not a hospital, in that home not another equipment. Okay, that's why we should maintain the all articles in that bag. That is the nurse's responsibility. The bag should contain all necessary articles, supplies and equipment. The bag and its content should be cleaned, and the bag and its content should be well protected. That is the nurse's responsibility. Okay, and hand washing should be done frequently. When the opening the bag and you doing the procedure, you clean your hand thoroughly, and the bag should be cleaned thoroughly before reusing. After using, you should clean the bag. Then record the procedure after performing. Whatever the procedure you done means you should record in a one book. This is the bag technique. Understand?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Next one is okay. Role and function of community health nursing family health service. Role and function of community health nursing family health. You making note time, you should maintain the heading nicely, then you write it down. Okay, clearly. Generally, you can understand easily what is the portion, what is the content inside. Simply maintaining making notes means you cannot read the community health. Okay, because you can, you now also you realize that family health service I am given so many topics. That is mixing it, means all together one. But heading is very, very important. Okay. Role and function of community health nursing family health service. That is the one next topic here. The role and function of community health nursing family health service are a vast and varied. She played different roles in different settings of family health service. Some of her functions are described as under. She has some services in the family health service. First one is the survey worker. She collects demographic facts. Okay. In our house coming somebody for survey worker. Maybe she is in a health nurse. Okay. Government may be allowed to do the health work. It means survey work for a nurse. Okay, that is a common. And they make a list of a number of houses and finding out their location. Where the house, how many houses there, that we should make it. And collect information about pregnant mother, eligible couple, children, and infant below the school going age. Okay, collect information about here about I'm mistakenly typing. Okay, A-B-O-U-T. Okay, you writing time you should collect the information about A-B also you mention. Okay, and mothers and eligible couple and children and infant below the school going age. That is the survey work. 3 point only I am given. You should study the 3 point. So many is there in a textbook, but I am selected in a 3 point. That's enough for a survey work. Okay. She collect demographic factor and make list of a number of houses and finding out their location and collection information about pregnant mother, eligible couple, children and infant below the school going. That is the survey worker. Next one is the health educator. Educate the individual and family and the community regarding the prevention of communicable disease. Okay, educate the individuals and family and the community regarding the prevention of communicable disease. Next, teaches about nutrition and diabetes, balanced diet. Nutrition and balanced diet. And teach the family about personal environmental hygiene. And teaches mothers about importance of breastfeeding and immunization of the child. That is the health educator. We want to teach the family member about each one. It means prevention of communicable disease, about the immunization, about the feeding and about the environmental hygiene and about the nutrition and a balanced diet. That is the health educator responsibility. Understand?
Yes, ma'am.
Yes, ma'am.
Coordinator and provider for a primary healthcare service. Coordinator. Coordinator means one coordinator is there, no? One work is there means one member is there for a coordination ship. Okay, she will coordinate all people and she will do the work. That is the coordinator. Provide direct care to the families within the legal and professional limits as per the standing order of the state government and state rules and regulation. She coordinates the service of physician, surgeon, dentist, nutrition, social worker, Ayurveda, yoga, and neuropathy. Okay, that is the coordinator and provider of pharmacy, primary health care service. It means one primary health center maybe this will have, and that's for all responsibility that head nurse only. It means community health nurse only. Any program, it means a nutritional advisor, maybe social worker, maybe Ayurveda, otherwise yoga. Any classes she want to conduct. That's that time she is a coordinator and she is coordinator and she will do the work. Next one is the motivation on function. Motivation function. It means motivate the eligible couples about the use of contraceptive and adopting sperm. Okay, eligible couple means yesterday in family planning I am told what is the eligible couple. Okay, in contraceptive it means provide the family planning. Okay, control the children. That should be motivate the eligible couple and explain the importance and the necessity of the family planning and identify women needing MTP and referring them to the doctor. MTP means what? What is MTP? Anybody?
Medical termination of pregnancy, ma'am.
Medical termination of pregnancy. Okay, that is the MTP and referring to the doctor. That is the motivation function. Next one is the family care plan. Prepare the plan for the health team as an integrated team approach is needed for better health of the family. It means a consultant, collaborator, counselor, researcher. That is the family care plan. As a consultant, it means anything happening means as a consultant, we can do the work and a collaborator and counselor and a researcher. That is the family care plan. Here I am given one family health nurse responsibility. Whatever the role of the community health nurse in the family, researcher, survey worker, health educator, motivator, advocate, family care planning, manager, collaborator, counselor, leader, coordinator. Okay, you should maintain this also. That is very, very important. Community health nurse in the family health. Okay. Now understand role and function of community health nurse in family health service.
Yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
Now I am finished the next chapter also, and evening I will go with the next chapter. Okay.
Okay, okay.
Okay, ma'am.
Okay, ma'am.
Okay, ma'am.
Now easy now community health.
Yes, ma'am.
Yes, sir.
Yes, sir. Only second chapter is vast.
Which one?
Second chapter only, ma'am.
Which one?
Second unit.
It is second chapter, epidemiology. No,
Yes, ma'am.
epidemiology difficult.
Difficult, vast syllabus, and this is the small topic. That's why easy to study.